Got siete coming in. What condition is anterior uveitis associated with? Sarcoidosis. Regarding standard deviations, you have 1, 2, and 3. What percent inclusions are they? 68, 95, and 99.7 respectively. If you suspect restless leg syndrome in a patient based on clinical history, what lab value should you order? Ferritin. How do you treat restless leg syndrome? Pramipexole. If you're talking to a patient and you're empathizing with them, could you say something like, let's look into a program to get you back on track? Yeah, that's what you would say. And what is necessary to document before beginning any sort of treatment? Informed consent, right? What sort of training can help with urinary incontinence? Bladder training, as well as timed voids. That's how you manage urinary incontinence initially. And the medication for urinary tract incontinence is what? Toterodone, right? Toterodone. If you have a patient that doesn't want treatment, what should you do? Document the patient's refusal to discontinue and document the patient's refusal to do the medication or follow the recommendations and discharge them, right? Schedule a follow-up too. What sort of medication can you use to treat keratosis pilaris? Urea cream, okay? What action helps avoid central line infections? Sterility. What increases bleeding risk and platelet dysfunction? It's a herbal supplement. Ginkgo biloba. You want less, so rule out hypoglycemia with long-acting basal insulin versus NPH, okay? You just got to remember that for somebody who's changing their exercise regimen. If they're diabetic, you adjust their insulins accordingly. You don't want them to become hypoglycemic. But note that type 1 diabetics will always need some form of basal insulin. Okay. If a person has sudden abdominal pain out of proportion, what condition should you suspect that they have? Acute mesenteric ischemia, right? If a patient has congenital adrenal hyperplasia, what enzyme are they deficient in? 21 hydroxylase deficiency. If someone does have 21 hydroxylase deficiency, what will be elevated and what will be deficient? 17-hydroxyprogesterone will be elevated and 21-hydroxylase will be deficient. If a patient has hydrocortisone treatment, how do you treat congenital adrenal hyperplasia? Hydrocortisone, right? What causes typical wrinkles in an old lady or whatever? UV light. And what's the technical term for that? Photo aging, right? Is photo aging worse in smokers? Yeah, photo aging is worse in smokers for sure. What sort of medication could you use to treat photo aging? Tretinoin. In non-emergent situations, do you need consent to treat a minor? Yeah, haha, you do. If it's a non-emergent situation, you need that consent. If it is emergent, you can treat, but if it's non-emergent, you need to wait for the consent. All right. If someone has a prolactinoma, what are they at increased risk of developing? Here's a clue. Vitamin D helps prevent it. Right. Osteoporosis, right? Osteoporosis. Um, if you have a patient and you're in the ER, right? And then you suspect a cocaine overdose, how do you treat? Lorazepam, right? Lorazepam. What sort of issue can a cocaine cause in basically like a healthy person? Dissection of the aorta. Ooh, nasty stuff, nasty. How do you treat a spontaneous bacterial peritonitis initially? With IV antibiotics and albumin, right? Yep, yep, that's how you do it. What is the most important factor for determining the MELD score? Serum creatinine, right? Serum creatinine. Um, what sort of lab value can you use to diagnose systemic lupus erythematous? Anti-double-stranded DNA antibodies, right? And let's see. Anti-double-stranded DNA antibodies, do you use those to monitor how well a person is doing with SLE as well? Yeah. What two basic medications can you use to treat systemic lupus erythematous? I'll give you a clue. One starts with a P, and one starts with an H. Prednisone and hydroxychloroquinolone, right? Um, how do you, like, what sort of study do you use to diagnose narcolepsy? A sleep study. Oh, yeah, yeah, you know that one. How do you treat narcolepsy? Modafinil. Modafinil. How do you treat cataplexy? Like when narcoleptic just falls out of sleep and just like they're standing in line and they fall asleep and they fall on the floor. How do you treat that? Venlafaxine, right? Venlafaxine. So you have a patient, you're in your clinic, someone comes in with lupus and you want to see how their kidneys are doing. What should you do? Perform an ultrasound guided biopsy for lupus nephritis. If someone has complement and anti-DS DNA antibodies, what do they most likely have? Lupus. And you can use those basically to monitor lupus, right? If your patient has acute hepatitis B, but you can't really, do too much with a graft that you associate with acute hepatitis B, do they need close outpatient follow-up? Definitely do. And within what time frame or how long do you want to wait to repeat the hepatitis labs? 3 months, right? What's the risk of chronic hepatitis B? 5%. If a patient has a simple breast cyst, what do you want to do? Follow up with ultrasound in about 4 to 6 weeks. How do you treat acute gout attack in one joint for the most part? With intra-articular corticosteroids, right? And children with latent TB, should they get treated? Yeah, obviously. And how should they get treated? What two options, basically? Isoniazid for 9 months if they do not work. do rifampin for 4 to 6 months. Like if the isoniazid is first line, but if you know that the TB through microbiology is resistant to the isoniazid, then you want to do rifampin for 4 to 6 months. Okie doke. Sweet.